Hi, welcome to Ahia Medical Center. I'm Shelley Kirkham. I'm one of the co-chiefs.
Hi, I'm Andrew Chang, one of the third-year residents, also one of the co-chiefs.
Hi, I'm Ahia, also one of the co-chiefs, and I'm originally from Hilo.
I'd like to tell you a little bit more about our hospital here. We're actually the largest hospital on the island. We're located on over 20 acres. We have 275 beds between our acute care hospital, our behavioral health unit, and our long-term care facility. We have over 1,200 employees that include medical staff that consist of over 250 community physicians, physician assistants, and nurse practitioners. And we represent over 33 specialties on the island. We have 9 outpatient clinics that offer both primary and specialty care. We're in a period of growth, many new changes coming to both our residency program and the hospital, and we'd like to show you some of that. To start our tour, we're right outside the hospital. Behind me is our brand new lobby, just recently opened this week after almost 8 months of construction. To the right is our outpatient clinic where we provide primary care, and to the left is our emergency room. So let's go inside.
This is the entrance to the 1190 Waianui Clinic. This is where the residency sees their panel patients for primary care. We'll spend the bulk of our time here. We're well supported by the attendings and the nursing staff. This is our awesome front desk staff who support us and help schedule and coordinate with patients. So this is where our nursing staff sits. All the residents are split into 3 teams, and each team has a dedicated nursing staff that helps us coordinate care. We have Momi here. She's our community health worker. She really helps us a lot with coordinating complex patients and really roping in any community resources, and she's been a great addition to our clinic.
A little bit of what I do is I connect our patients with services they may not know about, usually for either free or at a low cost. I look forward to each and every one of you. I hope to see you soon. Aloha!
This is our main precepting room. This is where we come after seeing our patients and we discuss the care plan with the attendings.
If you enjoy having a high quality of life outside of work, then you can't ask for a better place to come than the Big Island.
I'm looking forward to taking care of patients of all age groups, and I think that this residency program will set you up to do that. So good luck with your applications, and we look forward to seeing you.
Next we have Dr. Kind, one of our gastroenterologists. We were very lucky to have him here. We round up on the inpatient floors and also in the clinic, and he really helps us break down complex issues.
I enjoy working with the residents. Oftentimes we'll round in the morning, see patients. You see a lot of different pathology over here that you don't see other places. So it's a nice setting where you can kind of have balance as far as living and also working and learning stuff. Thank you for considering our program, and we hope to see you soon.
We do various procedures here in this clinic, including shave biopsies, punch biopsies, Nexplanons, IUD insertions, joint injections, vasectomies with Dr. Rose. We also have a new POCUS program where we really focus on using the ultrasound to help us with injections and other procedures.
I am very excited to teach residents. I bring with me some extra training in breastfeeding medicine, so I'm really looking forward to sharing that knowledge with you all. I also love to deliver babies and practice the full spectrum of family medicine, including surgical obstetrics. I look forward to meeting you all soon.
We implemented American College of Lifestyle Medicine's residency curriculum here at our program. In short, it's a great opportunity for our residents to learn more about some of the things that contribute to chronic disease that are actually reversible so that patients don't always have to be on medication. Thanks for your interest in our program. We look forward to seeing some of you for interviews and hopefully next year as the new PGY1s.
We're here in our emergency department. This is the second busiest emergency department in the state of Hawaii, seeing about 40,000 patients a year. The ER docs here are really great. All are very enthusiastic about training us. Our hospital is stroke certified and also is the only hospital with interventional cardiology on our island, so we see most of the patients with cardiac conditions as well. This is one of our new cardiac cath lab, one of 2. Operating currently is one of our residents, our new interns, Dr. Ignacio.
I just came out of the cath lab with one of our cardiologists, Dr. Kovar. He was explaining the whole procedure, and it was a really exciting process, and grateful to be a part of it today.
This is our labor and delivery department where we do obstetrics and also inpatient pediatrics. Let's see if any of our residents are on service in the nursery right now.
Welcome. My name is Craig Berger. I'm a pediatric hospitalist here at Ahia Medical Center. One of the beautiful things about being in an unopposed pediatric family medicine program, you'll get to work directly with the attending. There's nobody between you and the attendings, so this is a great opportunity to have direct learning.
We work both in the nursery and doing admissions from the ED to the floor, so we get a big spectrum of training in pediatrics here.
When researching residency programs, I found that I was more drawn to ones that were culturally sensitive, and this one was by far one of the most culturally sensitive ones that I could see.
Hi, I'm Lorene. I'm one of the current seconds second years. I'm from Waipahu. So glad to be here in Hilo, back in Hawaii, and thank you for considering our program.
Our hospital delivers approximately 100 babies a month, and we are able to practice and learn doing both the obstetrics and the pediatric aspects of care. We also do our own continuity deliveries for our own patients. We will be their primary care physician and also deliver their babies and handle all of their prenatal care and take care of the baby as that child's pediatrician. Our excellent labor and delivery nursing staff are an integral part of our training here, and we're really happy to have them. This is our newly renovated physician break room in the hospital where residents and other medical staff can find coffee and pastries. This room also includes computer workstations to complete charting, as well as couches to lounge in. Also on the same floor is our labor and delivery unit and pediatrics unit, our medical floor where most of our medical patients are cared for, as well as our progressive care unit, which is a step-down ICU unit. Let's go down to the second floor where our ICU is and other patient care floors are to find our inpatient team.
Here we are at the entrance of our ICU. We actually have an open ICU here, and we work very closely with our intensivist, hospitalists, and we admit our own patients. We get to do lots of procedures here with the assistance of our intensivist, including vent management, central lines, intubations, all of the critical care you can need. We have 11 beds at this time. We're in the process of building a new ICU. Pretty standard ICU. We have a centralized nursing station. All of our patients are located on the perimeter. We also have cameras in each of the rooms, so all patients are watched by the whole crew at the same time. Let's talk with Dr. Thielen. He's one of our second-year residents that's currently doing his ICU rotation.
It's been a great experience for me because I'm interested in rural medicine, specifically working in the future as a hospitalist, potentially doing a fellowship. So here in the ICU rotation, I'm getting a lot of time spent doing invasive procedures, managing critical patients, learning different lab work that's related to these specific patients. So overall, having a great time here and learning a lot.
On the second floor of our hospital, just adjacent to the ICU, is our orthopedic clinic and a brand new pulmonology clinic, right next to our resident workroom. Let's go meet the team that's on today. This is where we spend a lot of our time when we're on our inpatient rotation. We do 2 weeks at a time. We can do table rounds, we do walking rounds. We adjust it constantly depending on our patient population. One of the benefits that we have here at this residency program is that we actually round with our pharmacy team and pharmacy students.
I love this residency. I think in terms of all the residencies that I could have been in, this is the one that fits the most for me and for my family. Things that drove me to select this residency was being able to be in a beautiful setting, and also the lifestyle medicine curriculum was something that really resonated with me. It was something that I felt like I wanted to include in my future practice, and so that was a big draw for me.
To me, what's special about our program is the diversity of cultures that are here, the diversity of our residents as well, and the diversity of medicine that we're allowed to practice here. As someone who was born and raised in Hilo, I was able to come home and be a part of the solution to our primary care shortage here. And I think that I made the right choice.
One of the best parts of this program, I think, is actually the community that we live in. I also like that it's an unopposed program. You get a lot of one-on-one attention, working directly with the attendings. And our specialists are the nicest in the entire world. You couldn't get nicer specialists. They talk to us day and night and make themselves available to us. It's a great program, and I would definitely choose it again.
What I really love about this program is the independence that our faculty give us. I'm from New York. Coming to a small town like Hilo, you're able to really practice full-scope medicine and really make an impact on the community. And I really feel that love from my patients who really appreciate what I do, and also the rest of the residents here. So I have no regrets moving several thousand miles away, and if I could do it again, I would definitely choose our residency program.
Thank you for coming along on the tour with us. We hope that it gave you some insight onto how we all work together as a family and what our training facility is like. We really hope that you'll consider applying, and we look forward to speaking with you.
We're so excited that you guys are interested in our program. Just wanted to give you a little bit of some background about me and why I came here. My training is in rural family practice. I completed a 1-year rural family medicine fellowship and still have been practicing full scope family medicine with high risk OB, including C-sections. That's part of the vision that I hope to bring here to this program and to this community. The bigger vision for our residency program is to get well-trained residents in the Pacific Islands, and specifically tropical rural medicine that this community has to offer here at Hilo. There is no shortage of pathology in this community, and I also think that our community of patients is a very unique group. They've been through a lot over the years. They've been through dengue outbreaks, they've been through tsunamis, earthquakes, volcanoes, and now a COVID-19 pandemic. One of the things I've noticed about this community, including the physicians and the people that live here, is that they all tend to check on their neighbors, make sure everybody's doing okay. And I've seen that in our residents as well. So we're so excited for you guys to be able to take our virtual tour today and looking forward to meeting you guys on interview day. Thank you.